Morning, wherever you are in the world. Welcome to the fourth panel of Prodigy Bureau in collaboration with Ladies of All Nation International UK. I would like to thank our beloved frontliners, our distinguished speakers, for accepting our invitation to be part of this panel. The core objective of this webinar is to educate and update our constituents and the world as a whole on what are the facts, the truth, and the real score of the effect of COVID-19 in humans and the world as a whole. And through this webinar, we can inform them and educate them on how our frontliners are working collaboratively to solve the world's biggest challenge. I am Lau Shermaine Oichoko. I am Prodigy Bureau's Managing Partner and Chief Operations Officer, and I'm very proud to have you on board. Without so much ado, I would like to introduce to you our amazing host. We are very privileged to have her with us, live from Cyprus, a transcultural psychotherapist based in Cyprus, personal and corporate advisor, mental health, wellness, and fitness, CEO and founder of Kayana Breathwork, and a very amazing author. Ladies and gentlemen, please help me welcome Viola Edward.
Thank you so much. That's so beautiful. For the host to have all this. Thank you very much. I'm privileged and honored to be hosting this amazing webinar with all of you from around the world for many reasons. One, because I'm very health conscious. I did learn about health and how important it is in my early 30s and have achieved in my life. And also because I have been exposed to health and death from an early age in my family. So this is very, very important and heartfelt gathering. I welcome you all, and I start with, I'm going to introduce you one by one.
Viola?
Yes?
Excuse me. I would like to interrupt. I can hear some echo. Before we'll start, please mute or only use one gadget in the room. Because if we will use the laptop or a PC, then we have another gadget ongoing or
you need
joining the event. It will be having an echo inside the
yes,
chat
I
room.
think some of the audience have their microphone open.
Yes.
Please close the microphone of the audience. It's very important. Okay.
Now it's okay.
Okay, so I will introduce one of the doctors and ask some question, and they go on like this. So it will be much more dynamic than introduce you all at the same time. Is that okay with you? Yes? So let's start with Dr. Ramadan Al-Lushi. Is an experienced chief executive officer with a demonstrated history of working in the hospital and healthcare industry. Strong business development professional skilled in healthcare consulting, medical tourism, strategic negotiation, business planning and government. Currently, the CEO of the regulation sector at Dubai Healthcare City. Welcome, Dr. Ramadan.
Thank you very much, Viola.
Yes, so tell us, how was it for you, for your population, what we went through in the COVID-19 between March, April, and May?
Well, as any nation in the world, actually, we were trying to be at the beginning prepared for such a, you can say, shock to the whole world, actually. It was not an easy task to start with, especially that the announcements went very fast from the day that WHO announced it's going to be it's pandemic until it reached all the world. And in Dubai, for example, the first case which was discovered in Dubai was in Dubai actually, and it was end of January. So we had to be really firm about it. We took really strong measures, and sometimes you could say, is it economy or is it virus? So the equation was very simple, that you need to put the human being at the beginning. You have to save lives. So it was really harsh, but really good measures to be done in the whole country to do such measures. We were following, of course, the international guidelines in treatment, international guidelines and how to prepare the patients and the families. But one of the really most important things, which we think in UAE we succeeded, is that we talked to the society, to their own language. We have about 10 million people in UAE. 1 million are from UAE national, but the 9 million are expats. And when I say 9 million, we are talking about different nationalities. So we had to speak to their own language and to their own level. We have businessmen, but yet we have laborers. We have different laborers from different kinds of the world. Even we have laborers from the same world, which they from the same country, which they speak different language. So we had to do some strategic approach to them, because it's not easy to, for example, one of the things, it's not easy to take a patient and tell him you're gonna be isolated in a single room for 14 days and you're gonna just watch the TV and you're not allowed even to touch the door. So if you're gonna talk to a patient, he's still a human being. He's living his whole life for a certain routine. Whatever routine is that, to see his friends, his family, to see TV, to go to movies. Suddenly you stop him and tell him, listen, I'm gonna lock you for 14 days. So we had really good, big challenges in how to talk to those categories. But alhamdulillah, I think we succeeded in the whole country, how to do it.
Now, Dr. Ramadan, may I interrupt you?
Sure.
So when I ask you to tell me, I forget to tell you, like, let's start with 2 or 3 minutes, so all of you can, and I'll come back with the question. But we have an idea about how you approach it. I'll be back to you, and I need to welcome Dr. Eshil Anand. I know you cannot be with us all the time, so I'm going to introduce you. Dr. Eshil Anand is a MBBS med, all the title besides, so it's going to be difficult for me to say, maybe MRCE, CP, consultant psychiatrist in United Kingdom, doctor, entrepreneur, charity worker. He worked for the UK National Health Service, NHS, for 20 years, founder of Yorkshire Indian Business Network and member of Royal College of Psychiatrists. My honor to be with you today. Welcome.
Okay, thank you very much, Waila, and thank you for all the participants today. I understand, I'll speak briefly for 2 to 3 minutes about the situation in UK. Can you all hear me?
Yes. So, Dr. Eshil, if it's possible for you, I want you to COVID-19 lockdown, and if you can do it in around 3 minutes, and I'll come back to you very soon.
Okay. Sorry, can you repeat the question, Waila? Your skin got froze. I couldn't hear you.
Yes, I wanted the first question is your impression and your where you were during the first stage of during the lockdown, and I know some of you have been in the front line, and in your role as a psychiatrist, also tell us how do you see it as a doctor, how do you feel it as a human being?
Yeah, it's been a difficult, as you said. We have different roles in our lives. One is a professional role. I am a dad, I'm a husband, and I'm also a father. So, and also a community member. So different, this is probably a once in our lifetime. I don't think anyone has ever experienced anything like this in our lifetime. You can't go out, your freedoms are restricted. And so it's been a very big challenge. And even for doctors, we are used to seeing patients and we think, patients are our first priority. And now there is a situation where, in fact, we are doing all telephone consultations. In psychiatry, in a way, at times we are on the front line, but sometimes, we are not like, say, on a general hospital where we see people on a day-to-day basis. But still, even though psychiatric patients are not directly affected by the virus in a way like, say, other elderly people or anyone, but mental health problems has increased due to this current lockdown, and also due to the fear, what we call anxiety neurosis. We see so many people, with increasing depression and anxiety, and these are people are not able to get the enough and whatever the one-to-one help they normally get. So it's been a very challenging situation. And we are in a different phase now. We are in UK. Probably I'll come to that in the next time when you ask me about what's happening now. But generally, yeah, it's been very challenging, both as a person and as a professional and as a doctor.
Yes, and how long you can be with us? How long you can be?
Unfortunately, I need to leave at 4:30, 4:30 in UK time. So it's in I can be here for another 18 minutes. Sorry about it.
Another 18 minutes. So I ask your permission, all the doctor teams, to continue with Dr. Eshil. Is because all of us, I'm sure we would want to hear about his experiences and what's going on now. So with your permission, I'm gonna go with the second question to Dr. Anand. So Dr. Anand, and how is it now after the lockdown?
Okay, so it's been a big challenge, especially educating the public. People always thought, it's only the elderly and the vulnerable people who are going to be affected. And then news starts coming in, it's not only that, and in fact, there is a recent study, UK is a multicultural country where there are, a significant amount of ethnic minorities living here. And recently it's come to we don't know why, but people with ethnic minorities, here they call it BAME, black and minority ethnicities, they are more significantly affected by the COVID. The death rates are more, and also people are more affected. We still don't know, the research hasn't identified why. Is it because genetically, people with ethnic minority communities are more prone? Is that because they have more hypertension, diabetes? Or is it just, they have, is it some of the behaviors which is contributing to that? So that is what's going on now. So we are in a process of educating public. Initially, stay at home. That was what our Prime Minister was telling us. But now it is, gradually things are opening up. I think from next week, non-essential schools are opening. Primary schools are opening from tomorrow. Non-essential shops are opening in 2 weeks' time. So things are moving on. Even some sort of, there was some sort of, I would call a delay in getting all the PPEs and equipments and things like that. But at the moment, we have a testing system, and also an antibody testing system is coming up. And we are planning for an app wherein they can test and trace, rather than a complete lockdown. So we are moving towards what we call a self-isolation. So you get it tested, and then if you are tested positive, it's only your family and people who you were in contact for the last 7 days, they will be isolating. So all those processes are happening. So things are evolving on a day-to-day basis.
Yes, what I mean is, what about anxiety, depression, and suicide attempt?
Yeah, that is unfortunately, two things. Number one, there is lack of awareness about mental health. People don't recognize it. There is a significant, equally, I would say, like people affected by the physical health problem, people have been affected by the mental health problem, especially anxiety and depression. People have, it's a very complex, people think, in fact, some people don't believe in mental illness at all. People, because you can't see it, or maybe it's all strange. People can't, or there are many cultural reasons as well, depending on the cultural background you come from. People have a different variations. What we are now educating is, if you are vulnerable, some people, if you have a past history of depression or anxieties, or if you have your what we call pre-morbid personality, some people are more prone to that. And you are constantly now watching on the news about death. It's and the scores are coming up, like a football or a cricket scores. Every time you get scores on the thing, and that's making people really, really worried. People have people can't sleep, can't eat. They have what we call catastrophic thinking. They think they are going to die. So those things are happening now. It's definitely, and I'm sure. I can't give an exact figure on the increase in suicides, but I think generally mental health problems are on the increase.
Thank you, Dr. Anand. Thank you. Be with us a little bit more. So I will pass to introduce my dear Dr. Ella Manga. Ella is an integrative medical doctor, author, speaker, and leading voice in the field of mind-body medicine and wellness. She is the founder of Breathwork Africa, an organization that offers training and support to breathwork practitioners across the Africa continent and globally. And also she specialized in burnout. Welcome, Ella.
Thank you so much, Viola. Thanks for having me. And hello to all my wonderful colleagues all over the world. It's so lovely to connect with you.
So Ella, I know you were working, especially now, actively in how to sustain, how to hold what happened during the lockdown. Tell us, what is your impression of after the lockdown?
I think, Viola, before I answer the question, you know, I just like to reflect on some of the principles of healing and health that we've seen show up in the way that we have related to this pandemic from our perspective. So we are now 75 days into the lockdown period since the declaration of disaster by the government. And 30,000 people have tested positive in South Africa. Over half of that, so 16,000 people, have now recovered. And there are 643 deaths reported. This was the latest stat from yesterday. Now, our government implemented a really strict and rigorous lockdown based on the guidelines that were coming from the experts from all over the world, but also based on our actual socioeconomic situation, specifically in South Africa, with a very high prevalence of HIV, a high rate of obesity and hypertension. More than half of the population in South Africa, more than 50%, is hypertensive with a very low control rate. And based on all of these factors, the government implemented a really strict lockdown. What we have seen has been really interesting. We haven't seen the tsunami that we were expecting based on our current health situation and our socioeconomic situation. And so this is really speaking to a principle of health that I think is really important, and that is health is relational. We cannot see symptoms in isolation of our unique situation. And this I speak of individually and collectively. It's not a one-size-fits-all approach. And so this is just something that I'm observing is, you know, I think that every individual and every government system and every health system should contextualize their policies based on the current situation and the unique situation of every single country. So I just, you know, for me, I'm seeing this playing out and the importance of understanding that health is relational. We are relational beings, and we need to look at every situation in context. So, you know, that's a very long answer to your question, Viola, but
it's okay. We can, maybe what we can do is we stop here with your definition of how you see health, and then we welcome doctor, and then we pass through Dr. Bassem Bahrani, and then we come back to you. Yes, is that okay? So
that's
we
perfect.
keep it. So
Perfect.
we keep it very dynamic.
Perfect.
Dr. Bassem Bahrani, emergency medicine consultant, emergency doctor at Johns Hopkins Aramco Healthcare, fellow of the Royal College of Physicians of Canada, Ottawa University, member of the American College of Emergency Physicians, member of the Saudi Society of Emergency Medicine. Welcome, Dr. Bassem.
Welcome
Dr.
to you, Viola.
Thank you, shukran. So would you give us, like your colleague did, like an overview of what happened in your country and how it was approached.
Right. First of all, thanks for having me with you in this lovely webinar. So we were watching the news just like anyone else in this world, and we were watching this coronavirus spreading around, starting in China and moving from one country to another. And all of us thinking that we are far away, we're safe, we're protected. The first actually case came to Saudi was in early March, I think around March 2nd. But the Saudi government has taken measures even before that, and I have to say a very strict measures. Lockdown of the country, banning of domestic and international flights, closure of schools and malls, social distancing measures, public education was stressed on. And even for us in the emergency department all over the country, preparation was key. Changing the setting of the emergency department was key, because we know we're going to get an influx of patients coming to our emergency door. So we changed the setting. We put a visual triage system right at the door, so that people who come suspected to have the disease will be separated from the rest of the visitors of the emergency department. Protection of the healthcare workers as well was taken into consideration. Designating certain areas, isolating these patients to be seen in a different area. So a collaborative effort at the level of the country and level of each hospital were taken into place. And I have to say, I'll just give you a sense of where we are today in Saudi Arabia. As of today, we've got 85,261 confirmed cases, which puts Saudi Arabia at around number 16 in the world. But we've got around 70% is the recovery rate, around over 62,000. And the total death toll is around 503 cases, which is less than 1%. And I think proudly saying, our experience in Saudi is nothing short of successful. And this is given to, I have to say, it's our experience with especially at the level of the government, was full-heartedly committed to taking care of its people.
Thank you very much, Dr. Bassem. Thank you. We'll come back. So let's go, Dr. Rushidana. Welcome. Qualified medical practitioner from GNMCH ANU Stanford University. Certified in Social Innovation and Public Management. Stanford MBA, Stanford Biodesign Exchange. Team member to China, partner of Dana Group UAE, and president of Duluth Medical Tech, Silicon Valley. USA for ME, Next Gen Business Leader 2017-2019, and 2020 Top 100 Most Influential Women. Welcome, such an honor. So,
Hi, Viola, thank you so much for inviting me. It's such a pleasure.
In which country are you now?
I'm in UAE at the moment, Dubai.
So, tell us from your perspective and of course from your expertise, what is your concept on health? And after COVID, what is your concept on health?
Sure. So even though I'm in UAE, I'm very much in touch with India. That's my home country. So I can tell you that like in India, there's like a huge crisis right now because of COVID-19, and a bigger crisis than COVID-19 is actually the workers that are around in India. They're unable to go to places, they're unable to find jobs, and that's actually hurting them. So a lot of deaths are becoming, the cause of deaths are actually hunger. Hi.
Your microphone, yes.
Yeah, I think I got muted. Yeah. Yeah. So I was talking about India because I belong to India. So a major crisis in India, apart from COVID-19, is also the crisis of laborers, workers, because they're unable to find jobs and they're trying to go back to their cities because of the economic lockdown. They cannot do much. So at the moment, there are a number of deaths that are happening because of hunger. And that's really sad to see. And so in a place like India, where already there's like people are very much immune to a number of diseases because like it's there's a lot of herd immunity as well. So this decision of the government of having an economic lockdown was widely criticized, but I guess that it really helped in controlling the cases, because if the economic lockdown did not happen, then the number of cases in India would have been skyrocketing, because Indian people, they like the population per square feet is so high that it's impossible to maintain social distancing in a place like India. And Indian people are very much social and they like to go to the temples for praying and all of that. So that it would have been very, very difficult to get this done without very strict measures. So the government took very strict measures, but at the same time, there are some repercussions of that, not just on the economy of the country, but also on the workers and the population that's there on the ground. So that's something. So post COVID-19, I think like one of the focus that people would have would be on their own health. So a lot of focus is going from like reactive medicine to actually preventive medicine, because people are trying to take more care of themselves. They're trying to watch their diet and like take probiotics and get their like genetic and microbiome tests and all done, because to just get prepared for the future, right? So suddenly like everybody is getting so much more aware about their health, and I think that's actually good for the whole healthcare system as well, because it would reduce the burden on healthcare emergencies that would happen in the future. So if people take care of their health on their own, if they're into preventive healthcare, then the actual burden on the hospitals later on the ICUs would reduce quite a lot. So I think like post COVID-19, people would really pay a lot of attention to their health. They would be increased in the use of genetic tests, microbiome tests, and overall probiotic supplements and all of that, yoga, meditation that comes from India. So these are things that are actually upcoming at the moment. I think you're on mute. Viola, I think you're on mute.
Yes. Okay. Thank you very much. Okay, thank you. Dr. Ebere Onyeyi, welcome. Popularly known as Dr. Right Africa. Oh, I like that. Bachelor degree in Human Anatomy, Bachelor of Medicine and Surgery, University of Port Harcourt, Nigeria. Masters in Public Health, Health Educator, Public Speaker, and Cinematographer. Founder and CEO, Bien Health Initiative. Producer of Dr. Right Africa medical TV series. We'll go in there. Focused primarily to bring medical ignorance in Africa to the barest minimum. You are most welcome, Doctor.
Thank you for having me. Thank you so much.
So
thank you.
Tell us about this initiative of Dr. Right Africa.
Okay. Good afternoon, everybody from Nigerian time. Can you hear me? Hello, can they hear me?
Yes, we can hear you. Yes.
Okay. So Dr. Right Africa is an initiative, my passion, that is strictly on medical education because of the rate of ignorance, practices, myths, and beliefs that are completely wrong that is practiced in Africa, especially in Nigeria. So our primary concern is to educate the people on the right health knowledge, trying to reduce the rate and the burden of mortality from preventable deaths due to poor health practices. So Dr. Right Africa, we teach through one-on-one, we go to communities, we are invited to speak in local communities, but we do media. We are on all social media handle, and we do short movies to teach standard practices, because we realize that in Africa, people don't want to read. People find it difficult to sit down and read long materials. So we use media, movies, a series to teach them. They learn, they are happy, while we are passing the necessary information. So Dr. Right Africa, health education strictly, health education. Thank you, ma.
Thank you, doctor. I'll be back to you very soon. And I'll be back also to Ambreen. Dr. Ramadan, I'll come back to you. Dr. Ramadan, could you please unmute yourself? Yes.
Yes.
Welcome again. Welcome. Oh, that's beautiful background.
I was looking for a background, but my shape is.
Yes. And sorry to have cut you before, because we have the emergency of our colleague, your colleague who could not stay with us long. Thank you for your patience. Yes. So you were in middle of your presentation when I asked to.
How long I have, so I can talk about it?
Yes. So what we would like to know is that you were telling us about the way how it was so difficult, because you have like practically 90% of the population who are foreigner, and how to different culture, to people from different culture, how would you ask them to do what they have to do to keep themselves safe from the COVID-19, or in the process of the healing process? You were telling us about that, and that was one of the difficulties you were facing.
Yes, actually, the difficulty was basically in every country there is a peak of numbers which comes as a wave. And during that wave, we had a huge number of patients or positive cases from different nationalities. So it was extremely difficult. Why? Because you are not a healthcare provider to talk about only health. You need to talk about nutrition, about habits. Some of them, they have rituals. Some of them, they have religious beliefs. So you have to talk to every single individual according to what they believe and what they want. It was extremely difficult because we wanted to target them, and then we discovered that labor's area, for example, is totally different from a non-labor area. National citizens are different from expats. People who came from, for example, people who came from airport on tourism area, and then suddenly the airport was closed. How are we gonna deal with them? People who got cured after 14 days and they want to go back to their own country. How are you gonna deal with them, and how are you gonna convince them to stay until they go back to their home safely? So all of these were touched, and luckily the community in UAE was not basically, as a doctor you have to do everything. Actually, we were so lucky that the whole community was even volunteering. The number of volunteers even exceeded more than 20,000 volunteers in 1 week. And these volunteers from every single place in UAE, policemen, from civil, from government entities, private entities. So the gathering for them was really great, that they want to help. What we did basically, we had a team who was classifying them according to what is the need for area. For example, if you go to a place which is a labor area, and that labor area is, for example, from India. The majority of laborers, what we have in UAE is from India, and then Pakistan, and then Philippines. So when you go and talk to these different categories, you can't just group them together and talk to them, listen, you have coronavirus. Some of them, if you tell them you are positive, he thinks he's gonna die next day. So you have to talk to them basically in a scientific approach and reach out to them. And this is what we did basically. We even had the old way technique is that to print papers in their own language and give it to them to explain to them what is this virus. We had to go to the apartments of them and talk to them that what to do and what not to do. We had to even to label on their area of accommodation. We had to even go to the shops where they sell for them goods and so on, because labor areas are basically specific areas in Dubai. So it was at the beginning very difficult, but I believe that the total government gathering with the population, with the people around it, it made it really successful and easy. And of course, education and awareness was the key to get success. You need to boost, you need to keep talking to the society in different channels. And one of the really luckiest thing in Dubai or UAE that we do have strong infrastructure, and this is what helped us a lot. Education, for example, it was not easy to say next day, listen, in 1 week time, all the schools gonna be learning from distance. That was one of the key successful factors, that UAE telecommunication was so strong that we could do it in 1 week time. All the schools were ready to receive, to teach their students from home.
Yeah.
I know mothers and fathers, they suffered on teaching their kids as well, but still the school was ready to talk to the society how to teach them. We, for example, in UAE, many countries, by the way, they closed the schools and they said this year's ended and everybody passed. UAE said no, the school will continue until July as it is planned, and it was really accepted and everybody was happy. So the tackling for COVID is not basically about the virus itself, it's what's surrounding it. It's telecommunication, awareness, education. This is what the way we did it.
Yeah, of course, socioeconomic, cultural. Thank you so much for your participation, and I would very much go to what I have thought in designing these webinar instead of having all the time for your presentation, because I've been in so many webinars lately, and yesterday and the day before. I thought if we cut it in 2 or 3 minutes so we come back to it and all of you listen to all of you. So I'm gonna go to Dr. Ambreen and then come back to Dr. Erbire to hear about Africa and all what you're doing there. So welcome, Ambreen.
Thank you, Viola. Thank you, Ladies of All Nations, to host this webinar. And
Ambreen, would you allow me to say to our audience about you?
Sure, please.
Ambreen is a health entrepreneur. She's a medical doctor, GP, health and wellness consultant, chronic disease patient education, and self-care specialist. She's the founder and CEO of Medical Training Services, and her domain or expertise are care providing, patient community health empowerment, capacity building, and self-care education, chronic disease care. Thank you so much. We met recently just before the COVID in Egypt, and we're so happy to have you here.
Pleasure is mine.
Yes. So, how's your experience during the COVID, and how's your perception now? And if you can give us the first part of it, and we will come back to you.
Yes, it's very. I would second what Dana said earlier, that it has radically changed the approach of towards health of many patients, of people in the communities. Of course, as a world community, we had to face a pandemic, and thanks to the modern way of communication, the social medias, TV channels, it was covered globally. So everybody, I guess, was following many channels at a time, the American one, the British one, the Europeans, and the local countries where we're living or we're confined. And we were getting a lot of information. So I think what I would say as a healthcare provider perspective, what has changed is the lens through which people see health. How care providers now, I'm very surprised to hear that a doctor in an emergency, such as our esteemed colleague just right now talked, was not only talking about ER medicine, see it, fix it, but on a comprehensive way, talking about homeschooling, talking about educating people. That's brand new. In 20 years of experience, I have never heard any emergency doctor speaking in a holistic way. So that's what has changed, I think, through COVID. More later.
Thank you so much. Dr. Erbire? Yes. Welcome back.
Yes.
And give us more of what's happened in Africa and how you're doing it in Nigeria.
In Nigeria, when the corona issues came, it didn't start in Africa originally. So a lot of us believed it was the white man's problem. Our people had the wrong notion. Everybody felt, oh, it doesn't affect a black man. The sun is too high for corona. So the preparation and the reception was poor. But in February, we recorded the first case in Nigeria. A man who came in from Italy, an Italian who lives in Nigeria that came in from Italy. That's when we had the first case. And up until now, it's increasing every day. The challenge we have.
Excuse me, doctor. Would you please close your microphone? Yes, thank you, doctor. Sorry. Yes, please continue.
Okay, so when we kept having increasing cases in Africa, in Nigeria in particular. As of today, we have 9,855 cases, and we've had 261 deaths so far. The rate of infection and transmission is seemingly poor when you compare to the population. Nigeria is an average of 200 million persons. For the number we have, the cases are actually small. But I have an issue with it because when there is poor testing ability, when there is poor testing ability and poor accessibility, you may not have the true picture of the affected cases. But for now, we have these issues. People are recovering. Mortality rate is low in Africa here. But the major problem we have is that as of today, people still believe there is no coronavirus in Africa. People still believe, oh, you people know what you are saying. Somebody said, people are saying is malaria because of the symptoms are synonymous with the symptoms you have in malaria in Africa. People say, oh, coronavirus is malaria. There's nothing called coronavirus. Some people tell you that, oh, it's something the white man wants to use and kill a lot of people. It was man-made. So the reception to management and presentation is poor. And because of the poor socioeconomic status we have in Africa, corruption and everything, the testing ability is poor. So there's no house-to-house testing. Only people with symptoms present to the hospitals for testing. So their contacts are traced down, the ones you can get. So we have limitation in Africa, but as of today, most of the cases we have recover fully. All the deaths we have been associated with people with comorbidities, like diabetes mellitus and asthma patients, people who die, and older population. And you also know in Africa, we don't have very old people because when there's poor health status, people don't live that long, like what you see in Asia. It's not applicable here. So for coronavirus in Africa, it's here with us, but we have a problem. People don't believe it's here. The few people who have been treated, we ask you, if you say coronavirus have no cure, it's a viral infection, how come people get well? What did you use to treat? So it's basically a problem of myth in Africa. It's a problem of myth. It's a problem of misconception. It's a problem of corruption, poverty, and ignorance that we have here. But on a global scale, the rate of infection in Africa is low compared to other countries, compared to other continents too. That is what we see here. Thank you.
Thank you, Dr. Ebere. Thank you very much. Ella? Yes, Dr. Ella Manga? Yes. Okay, Ella.
Hi there. Yes.
Coming back to you. Hi there. Coming back to you, and after your beautiful presentation, how is the situation now? How, from your integrative medicine, you're dealing with the situation now?
Well, you know, Viola, you are aware that my perspective is holistic, and I'm really heartened to hear from my other colleagues that people are starting to view their health holistically. You know, I look at the situation and I am concerned. I'm concerned because I'm looking at the effects of the decision that was made for this rigorous lockdown on other aspects of health. And I'm not saying that we shouldn't have implemented such a strict lockdown. What I am saying is what we're seeing is, for the first time after a really long time, children presenting to the clinics with malnutrition. We are seeing that people with HIV who are on antiretrovirals haven't come to the clinic to get their regular medication. We are seeing a devastating effect on the socioeconomic level. People are going hungry, and we don't have the infrastructure of the first world countries to manage the impact of a strict lockdown. And it's just really to echo what Dr. Bero was saying. We have a different situation in Africa. But I think that it is important as a global health community to really ask the question around whether we are missing an opportunity here to really look at health more holistically. Are we still looking at the symptoms? I see the virus as a symptom of health systems being disrupted by the earth, nature being, with us being out of sync with nature. We are looking at environmental factors. We are looking at emotional factors. All of these play a huge role in how health shows up. And so, I wouldn't want us to miss the opportunity to really look at what health really means, and to see the multidimensional aspect that is so important, the emotional impact. We are living with an epidemic of fear that has come with this virus. What has the impact on this been? What will that impact be going forward? We know the impact of chronic stress on our health. What is this doing to the autonomic nervous system? Are we setting ourselves up for chronic inflammatory diseases going forward? A really serious epidemic or crisis in mental health globally? Are we addressing this? And it's just interesting to observe the rigor and the force with which we approached the pandemic. What if we applied the same kind of rigor and we placed the same importance on chronic illness as we did to the pandemic? What if we looked at a chronic illness in the same light and gave it the same importance as we're giving to the pandemic that is causing death in a very short space of time? In fact, chronic disease is killing so many people over a much longer time. And all the energy and all the effort and all the money that has gone into dealing with this pandemic, what if we applied the same approach to more chronic illness?
Thank you,
And
Ella.
so I'm just going to end off there, Viola,
Yeah.
because I'm going to wrap up my conversation.
Yeah.
And I'm going to just wrap up with a question. And the question is, when countries celebrate the victory of a strict lockdown because they have flattened the curve, or when we celebrate a victory because a vaccine has been found, will we celebrate that? Or will we be humble enough to say that we still have a lot to learn?
We still have a lot to learn. I can see you, Dr. Bassem. Would you like to engage in this conversation that Ella is opening here? What's your opinion?
I totally agree with Ella. We have to approach this issue holistically, and as some of the speakers say, we we were not looking, usually, you know, even for us as an emergency physician, we used to deal with the diseases, you know, as an emergency disease. We deal with the case by case and we move on. But right now with this pandemic, we changed our view. We have to reach our you know, patients and community even before they come to the emergency department. So I have to agree that a lot of investment, a lot of you know, a lot of education has to be done in order to control this this pandemic. It has changed our life, and definitely this is something that we haven't seen. It's unprecedented, and definitely life after Corona is not going to be the same. But it's an opportunity to learn for sure.
Thank you very much, Dr. Bassem. Dr. Dana, I can see you nodding your head and smiling about what Dr. Ella and Dr. Bahrani were saying. What can you add to it, or what's your opinion?
Yeah, I would definitely say like chronic diseases take a huge burden in the healthcare systems. Like there's long-term patients. They cost a lot for like all stakeholders. You say like hospitals, nurses, insurance companies. All of these resources are required to cater to this chronic disease patients. So if there was a way in which in one go we could come up with a solution, or maybe like catch these diseases earlier on, like early detection, that would be a great way to actually solve the crisis later on. Because the earlier you catch these problems, the better it is to solve it, and then like maybe even reverse some of these problems. So I think early detection and prevention, those would be the themes that we would see in the coming future.
Thank you, Dr. Lana. And Dr. Ambreen, we'll come back to you. Yes, I know this is the way you operate too. This is the way how you work. Yes.
Yes, absolutely. I'm a GP, so I practice with patient on, and as everybody know, the major part of the GP work is dealing with chronic patients, and some of the emergencies are again dealing with the chronic patients. And I think what's new here through these 3 months past spent in lockdown is that it's coming back, or it's given the opportunity to everybody feeling how it feels to be a patient or someone taking care of his own health. Everybody was all of a sudden stuck at home to be safe at home, to protect his own health, and to be the very first care provider. Everybody was thinking twice before getting out and going to a hospital or to a care providing setting. So that's a huge opportunity to reveal the fact that is every patient, and more specifically the chronic patient, is its very first own healthcare provider. And that's where I work. That's the field of my specialty. That is, we have to do much more to reverse this top-down practice of medicine, this dealing with acute cases, disease management, and go obviously more holistic and setting the patient at the center of this story, at the center of this partnership, not relationship, but having the patient as a strong partner in the care partnership. I think this is a fantastic opportunity to move on what we couldn't manage doing over the past 20, 30 years. But it's a hint for the new generation to come to say that you young doctors see your practice as a partnership all together with your patients to build health together, because the patient has his own say. He's the owner of his health. He will be, at the end of the day, applying the treatment you prescribe with your pen, and he agreed in the doctor's office saying, yes, doctor, I will do that. But he will do whatever he really wants to do at home. So how we embark on this partnership with providing more equity Is it probably with more health information, health literacy? As other colleagues said, that there are many, we had to go through another way to bring health awareness, to focus on the communities, workers, laborers, expats, to focus on the origin of people, speak to them in their very own language, to focus on their way of learning, produce visuals, like Dr. Ebere said, through social media, through visual TV channels. So we see that there was, over these 3 months, a clear shift in the way the health world globally, organizations, WHO, primary care settings, governments, Ministry of Health, are addressing health and are speaking to the patients. And patients are no more patients, they are people in communities. And that's what I will keep as the best lesson learned from these past 3 months.
Thank you. Interconnectedness. Dr. Ramadan. Hello? Yes, Dr. Ramadan? Yes.
Yes.
Hello again. Hello. So
Hi.
after hearing your colleague talking about how COVID had changed so many things and how much we have to learn from this situation that really touch us all at once, what's your opinion about what your colleague were just sharing?
I think there was a lot of focus about the patient and patient education and how they're gonna go with it, but also we need to stress on the system itself. As a healthcare provider, we need to change our thinking. The patients are not anymore coming to see the doctor every time. Now, one of the things we stressed in Dubai and UAE was telemedicine. Today is one of the most important things which you can talk to the patients. And by the way, many patients, they did not even come to the clinics anymore. Not because they are afraid from COVID, but because they knew that they don't need to go to the doctor. So I think the healthcare system will change. It's not, it's a matter of time, but with this pandemic, it changed the whole view of the systems in healthcare. It also changed the way we're gonna educate our children. It's gonna change the way we're gonna work. Today we are meeting here in Zoom. Before 3 months, if you ask many of us, including myself, I would tell you, no, I'd rather to come one-to-one meeting and face-to-face. But I think today with Zoom and Teams and other programs, we are meeting more. We're gonna meet more often. We're gonna talk to each other more often. We're gonna share our expertise is much more even easier and faster. One thing, one last message I could say, I don't think the issue of patient confidentiality and information will be the same now. Before, you say if my medical file is with me, I cannot transfer it to another hospital or clinic, or cannot share it with some other country. This is not gonna be anymore the case. If you're gonna be visiting any part of the world, you need your medical file to be there. I think even the companies, the medical industries, they will change their view, how they see the patient files and what should be shared as well. This is just a brief what I think.
Yes, thank you very much. Thank you very much. And Dr. Ebere, continuing this conversation that in a way also you started about educating, what will be your conclusion about what we're sharing here with your colleagues?
On education, what my conclusion will be is that from the viewpoints we all know now, things are going to change. So the method of education and the pattern of education is going to go down and become elementary. We're no longer going to bamboozle people with big lectures and medical information. We're going to learn to come down to the primary level of education. If every one of us understands that the next person does not have the adequate medical knowledge to survive because they believe in so many things they learn, we will understand now because everything is going to change. Principle of hygiene is going to be imbibed in all of us. So we will teach from the children, in the schools, in churches, in homes, at the hospital, and every other patient you meet, basic fundamental knowledge about health. Also, we will also understand that right now is no longer a business as usual for health practitioners. Emotions may no longer come in when you are seeing your patient. Because if it's before emergency comes into the ear, you rush help. Because we have Corona in mind now, it's going to affect how we think too. It's going to affect our emotions, how we react to the next patient coming in. So on the overall, we will increase our basic education, increase our own sense of safety, because in Africa, one of the challenges we have is availability of PPEs is not so available like you will have in developed countries. So we will educate even ourselves, educate our colleagues on the changing times with respect to coronavirus. So education now, elementary, teach them how best they will learn, considering the environment where you are. That's what I think we should do.
Thank you very much, Dr. Everi. And we have a surprise visit of, kind of surprise visit of Dr. Kunal Kalra, Senior Clinical Fellow Pediatric Neurology, Elderly Children's Hospital, Liverpool, UK, ex-fellow Pediatric Neurodisability, St. Mary Hospital, Imperial College Health Trust, London, ex-medical officer, MSF India, Delhi branch, LGBT right activist, India. Welcome, Dr. Kunal. Where are you? In which window? Hello?
Hello, hello everyone. And thank you, Ayla, for such a kind introduction.
Yes.
I will begin with, I'm sorry that I joined late. I was tied up somewhere and I couldn't start with you guys at 4 p.m.
So
yeah.
Dr. Kunal, welcome with us. We are just almost at the end of our, we passed the hour, and with your colleague here, we share about what happened in their country during the COVID and what's the perception now, and how we were talking with Dr. Ella that how much we still have to learn humbly from their situation, and we went into the subject of education and how the consultancy between how the relation between medical and patient will change. So what's your contribution for all what we been? I don't know which moment you came in, but welcome, and we just
Of course, the dynamics of a consultation between doctor and patient has definitely.
1 minute, doctor, 1 minute, please. Would you please close your microphone? Everybody close your microphone. Okay, thank you very much. Okay, minus Dr.
Yeah. Of course, the dynamics of the consultation that used to happen between a doctor and a patient has changed 360 degrees, I would say. Earlier, the consultation used to be face-to-face in a consultation room in the hospital setting. However, because of this COVID situation and social distancing, we have started telephone clinic and video telephone clinic.
Working capital funding for our business customers. And we're waiving setup fees.
Yeah. So through this telephone and video telephone clinic, we try to get as much information as possible. Yet I would say it does not match the face-to-face consultation. So of course, we will make mistakes. There will be some loopholes in these consultations, and slowly we have to work out that how do we get better in these consultations, and where are the loopholes, and what are the drawbacks of these consultations, and how we need to overcome these drawbacks. So yeah, it's challenging how we are rearranging the consultations between doctors and patients.
Yes, thank you. Thank you very much for being with us, and we will engage with you again during the question and the answer. So love, we are ready for your questions, and there is much more to share from our doctor teams with us here. Yes. Yes, thank you.
I'm back.
Yes.
I have a question for Dr. Ramadan.
Dr. Ramadan, I think he had to leave. Okay, but Any other question?
I would like to address this question to all the doctors. Regarding COVID-19, how can we detect what's the difference of COVID-19 symptoms to other illness, wherein we can really say that it is COVID-19? Because it's similar with other flu, it's similar with other illness, malaria, but then what is the distinct symptom of COVID-19 that we have to take care of?
Excuse me, who would like to answer this question?
Well, I can share my my experience with this. I mean, yes, we agree that the symptoms of COVID-19 are very similar to those of flu, especially at the early stages: fever, cough, sore throat. So, so there's no way you could differentiate between a regular seasonal flu and the COVID-19 just solely based on symptoms. So that's why during this time, we consider anyone who comes to the emergency door with these symptoms as a suspected COVID case, and we treat that as such. And the only way to know whether this patient is really COVID or not is to do the PCR test and then confirm the case whether he's positive or not. But to base, you can't base symptoms to tell you on whether you have it or not. So you can't say, just like we've heard, if you can hold your breath for 10 seconds, if you can do this and that, you know, it's not COVID. You can't. And right now, as an emergency physician, you know, I urge all healthcare workers to be really vigilant, because we've been seeing a trend of patients even presenting with really far related symptoms, and they turn out to be positive.
I have one question for you. There are patients also who presenting symptoms of skin, is this one of the symptoms?
So there have been reports around the world of patients with COVID presenting with the usual symptoms, but they also have some skin manifestation. They've been calling them the COVID toes or the COVID fingers. We don't understand fully how, you know, this virus is causing these skin manifestations. But yes, there are some skin manifestations associated with COVID. But as I said, we can't say that for sure that these manifestations means COVID.
Thank you.
I'd like to add here that these skin manifestations, so this virus causes inflammation in all over the body. That involves multiple systems of the body. That could be skin, that could be lungs. In cases of children, whom I work with, we call it a pediatric inflammatory response syndrome. So that inflammation involves multiple organs. There have been cases where it has involved brain and made encephalitis, inflammation of brain meninges kind of picture. So this inflammation causes changes in your skin, in your blood, in your lungs, in liver. So that causes this multiple organ involvement. And this infection is new to us, so we will get to see new things with this infection, which might be similar to certain other inflammatory conditions. So it gets tricky. It will be wise to make more case reports and bring on more and more papers so that we can differentiate these inflammatory symptoms from the ones we have had before. And yes, as Dr. Basim said, that testing is the key. Testing, testing, and testing. Without testing, we will be failed. Yeah.
Hello,
Okay.
can I make an input? In Nigeria here, testing is the baseline. So we notice there is increasing cases of patients with complete loss of smell and taste. in Nigeria here. Sometimes that's the presenting complaint. Oh, doctor, I cannot perceive anything. I can't can't taste anything. So it's not synonymous with malaria or any known infection. So outside the testing that is the baseline, we also get history of travel. Most times we get history of somebody who have traveled to a high-risk country or a primary contact of somebody who have traveled. So there's no clear division, like Dr. Bassem said. It still ends with the testing, but high rate of suspicion from the symptoms you will have in Africa here, which include loss of taste and smell, outside the high fever and all that, will help you say this is coronavirus even before the comes out.
Thank you.
Thank you so much. I have a question for Dr. Ruchi. Doc, you're into medical robotics. You are one of my speakers talking about medical robotics. So what is the healthcare technological innovations that you have been doing in helping COVID-19 situation?
Sure, thanks, Love, for that question. So I would like to start by saying that it's governments are really important. They have a very important role in supporting technological innovation. So as we recently saw in the UAE that golden visa was given to some of the UAE doctors, and that's something that was reserved for the wealthiest of investors, but that was given to doctors. So that was a very good gesture by the UAE government. Similarly, like if you look at telehealth, usually here in UAE there are two telecom providers, Due and Etisalat, and voice calls and all are not allowed online. But immediately, just as the coronavirus pandemic started, both the regulators, they started telehealth immediately. So the government is very supportive. That's a good thing. And about other technological innovations, I can talk about robotics. So robotics is being used all over in UAE in terms of like disinfection of the roads, and they're using drones and all. But there are also robots that can actually go to the patients and do their tests. Like it's like a robot with a keyboard and a chest X-ray machine can go and do the tests, and that way the doctors can be saved, and even the PPE and all the resources of the hospital can be saved. Similarly, there are robots that can go to patient rooms and deliver them food and medicines, and a number of these robots are actually being used worldwide. So a robot named Vichy was actually involved in helping doctors interact with patients. So these are the robots that can actually help in terms of like testing and normal things. But then there are other class of robots that are actually helping during the surgery. So those are called robots that assist surgery, so robotic assisted surgeries. So I can see a huge increase in the demand of such robots as well, because like what happens if you use these robots, the chances of infection are less. You need to use lesser resources, like lesser doctors. Like if in case of orthopedic applications, oftentimes there are two doctors in the OT. So you'll just require one. There's much more precision. You'll require less nurses, less staff. So all of these resources can actually be conserved for the COVID-19 patients that are out there. So this is a good thing that's coming up. I can see that in the near future, maybe robotic surgery would gain much more importance in the world around.
Doc, will it not affect the morale of the I mean, there's nothing wrong with the robots. We are going there. But then will it not affect the morale of the patient, because we are humans? I mean, the patients are humans. And then we also need, while we are sick, we need this emotional touch from our nurses, from our doctors. Some of our doctors are even praying for us while curing us. So what is your idea about what these robots can give to us emotionally? Thank you.
Sure. So if you talk about robotic assisted surgeries, the surgeons are still there. The robot just assists the doctor. So it's not autonomous robots. There's follows the path the surgeon gives them. And if you talk about the robots that actually go to the patients and give them medicines and all of that, these are the new class of robots that have come across. So in these robots, the actual benefit for the society and for the patients is that actually at least the lives of the doctors and the patients is safe, right? there's nothing much more important than their own life. So if suppose like an infected nurse comes into your room, right, that's much more harmful than having a robot come to your room. And worldwide, there's a huge shortage of PP. There's like oftentimes people reuse the same gowns and all because there's such a huge shortage. And it takes doctors almost like 1.5 hours to actually put on the entire PPE kit and then another half an hour to remove it. So these are the times that can be saved if you use such robots.
Thank you, Doc.
Thank you. Do we have other questions? Do we have other questions? Because I would like, if we don't have other questions, I would like doctors to open their microphone and maybe ask your colleague a question about their country or their practice. Would you like to do that? I think this is a great opportunity that so much talent, so amazing work from around the world that are here together thanks to Laoni and Prodigy Bureau. So if Dr. Elamanga and yes, Dr. Dana, if you have any question for any of your colleagues.
I would love to ask this question to Kunal since he's into pediatrics. So like what we hear all across is that children are not much affected and all of that. It's just like the high-risk population is mostly like the elderly population and people who have pre-existing diseases. So what's the general things that you're seeing? Because recently we saw that children are also getting affected and there are huge cases coming up.
Yeah. So I understand children are not severely affected, yet there is a group of children which have a diagnosis of immunodeficiency, and that immunodeficiency can be because of multiple reasons. It can be because of cancer, it can be because of some primary immunodeficient diseases which children have, and some complex neurological children who have complex neurodisability who are severely paralyzed. They often end up having a lung problem. So these group of children, they are at risk, and I have seen these children get affected with COVID and admitted in ICU with dire consequences. And apart from that, there have been few cases of inflammation that has spread across all the organs in normal children as well, although the incidence is less as compared to adults, like we were discussing this case of skin changes. And so there is a condition in children which is called Kawasaki disease. It is an inflammatory response to an infection. And we have seen that children with COVID have presented something similar like Kawasaki disease, yet the whole presentation is slightly milder and slightly atypical as compared to the typical Kawasaki disease. So yes, so again, immunodeficient children are at high risk, and there have been few instances of cases in which children have shown inflammation all over the body because of COVID. And it is, so the monitoring of these children is paramount, how these children, they perform in long term, because so many systems get affected, the cardiac system get affected, lungs get affected, liver gets affected. So it requires long-term monitoring. Yet I have seen that the severity of this inflammation is not as much as we have seen in adults or in the similar diseases we have seen earlier.
Thank you, doctor. There is any, yes, Ambreen?
I have a question to my doctor's colleagues. We have discussed that this situation has affected probably for a long time patients' behavior. We've discussed that it has impacted on the care system as well. My question is, in your practice, in your impression, or in your relation, how do you feel it will impact on doctors' individual practices?
Okay, I will suggest you if one of you can answer. Dr. Dalal had a lot of technical problems. She could not be with us before, so she's gonna enter to say almost hi and bye because we passed far away from the time, but I will suggest one or two maybe can answer this question to Ambreen, who would like, and then we give a space to Dr. Dalal that she's coming now. Yes, who would like to answer, Ambreen?
Hello.
Well,
Good. Hi. Hello, Viola. You are just an amazing lady, I have to say.
Well, Dr. Dalal, give me just 1 minute. We are here almost finishing. And I know we are all amazing, but with your technical problem, we thought we were not going to make it today.
Hello. Hi.
So could you please wait for us 2 minutes? There's a question on the air that needs to be answered, and we'll be back to you very soon. So,
I mean, from my perspective, I think it will change my practice in a couple of ways. One way is to be proactive and actually try and reach up for the patients and the community and, education even before they come to my doorsteps. And the second part is on my behalf is actually I have to take care of myself in order to take care of my patients, because I have to protect myself not to get the disease, and also my mental health. I have to really take care of my mental health. I mean, a lot of people don't understand the stress we go through, but it's enormous, and we fear for ourselves, we fear for our families, but we have to take care. We have a job to do. We've got enough, we have to take care of our patients. But all of these dynamics are we're going through it at the same time.
Completely agreeing. Thank you.
Also, one of the things that also changed in Nigeria, all the people with private practice are not allowed to manage COVID-19 cases. So we see a drastic shortage in the patients who present to hospital in private practice. So if you have a private hospital, you are going to see something that looks like a downturn on your patient volume. So it affects you economically, it also affects the whole system, except you work, because here you work in the teaching hospitals and you may probably manage a private. So you will see a direct effect in your hospital that the number of cases drastically reduced, because you don't know who is a COVID-19 patient until tested. So we see that come to us. I also have that preparedness to change my mind. There'll be a paradigm shift of what I said before, too much emotion. Before, somebody can call you and you go to their houses to offer some care, depending on what the matter is. That will be a history right now. Nobody should try that again. Any case, please present to the hospital. Not even phone medicine again, because telemedicine or phone prescriptions is something you will not want to risk, because you don't even know what you are managing with this advent of COVID-19. So that's one of the few things too that we change from our side.
Thank you. Viola, you're muted.
So thank you. I will introduce Dr. Dalal Akouri. So all of you meet her, and then maybe we'll have chance before we finish to hear her for some few minutes. Dr. Dalal Akouri is an advanced integrative medicine authority, author, medical contributor, global speaker, healthcare educator, and healthpreneur. Based in South Carolina, Dr. Dalal is the founder of AwareMed Integrative Clinic. Welcome, Dalal, and we're so sorry that you missed these almost 90% of this webinar, but it will be recorded and you will be able to hear all your colleagues. So our subject today, Dalal, it is about how the COVID had impacted us all, and each one of your colleagues talk about the impact in their countries, and also what is our feeling, perception, and expertise in what we're doing now for in boosting the immune system, for having more clarity, for giving more education in ourselves, in our life, people around us, and to your patient?
Well, I'm so excited to be here today. And I am very happy to share some information. The COVID-19 is something that really was supposed to happen no matter what. It was like a wake-up call to every one of us. It's like, please make sure you know how to prepare your body, your mind, your spirit, and be aligned and be prepared at all times. And it's not the last episode. This is going to be one of many. And if we are prepared, we always are ahead. And this is a time of change. It's a time of transformation. It's a time of looking at ourselves in a different way. It's time to see that things that we see today is never going to be the same tomorrow. Like even medicine is evolving. Even the use of help is evolving. We are going to be more effective, more efficient. And honestly, the problem that we have is depression and anxiety that is going to affecting many of us, is also going to affect a lot of things in the future. I think there's so much that we learn from that. The economic impact is going to leave scars in so many people's health. So many people had to endure starvation. Some people have to understand sustainability. I am really focused on helping people to understand sustainability. The land has everything for us, and we have to be able to tap into everything we have. So we have to become also what it taught me. You are in charge of your destiny health-wise as well, not just your doctor. Me as a doctor, I am your coach. I'm here to help you with all the expertise I learned over the years. But together, we can make it happen. And yes, virtual medicine is still an option. It's never going to replace touching and loving and caring. I cannot see life without hugging. I cannot see life without smiling. I cannot see life without continuous distancing. We can make virtual hugging to each other right now. We have to really start embracing the good and the bad and the ugly. This is the time of winter for all of us. Most of us hate winter. If I'm talking too much, please interrupt me, because I do not want to overwhelm anyone with what I say. Okay.
Love, tell me how long we have. We should be.
I'm sorry, I wasn't prepared. I don't look like I am always. I'm very sharp looking. I'm always prepared, but unfortunately the email went into my junk mail. And if it wasn't for you, Viola, I would have missed this amazing opportunity. So I decided no matter how I look, I'm appearing today. So that's another thing we need to learn is seize the moment, the minute, the second. There's only 1 minute left, and that's the only minute. So we have to really work together. We have to be strong. We have to be powerful. We're going to have a lot of difficult times, but together we're strong. Together we're power. Together we can conquer any disease. And you actually boosting your immune system with laughter and love and hugging in itself can protect us from many things. I have a lot of cancer patients that are my patients, and many of these should have been the first ones to develop COVID-19. They still come to my office and they never quit coming. And none of them developed it. They should have been the number one people to develop it. Their immune system is weak, down, but it's because of everything we're doing, including spirit, mind, body alignment, breath work like you do, loving, hugging. You know, virtual hugging is okay. It's hard for me not to hug because I believe in itself the higher frequency. So if we raise the frequency among ourselves right now, because we're all down. It doesn't matter how we look, how we act. If we're down from the inside and we have an appearance of happiness and joy, it still doesn't change anything. The truth is we have to raise our frequency. And I see you have like a, behind you, Dr. I can't see you. You know, I'm pointing at you. You have higher frequency behind you. You have the globe behind you. You have light behind you. You know, I have greenery all around me. You know, that's really important. It's just the frequency of the universe, and we need to line together. We need to. But I've learned a lot. This is not going to be the first and last. I want to help people. I want to raise the frequency. I want to work together with every single one to implement a lot of things I've learned and practice in medicine that really made me who I am today. The good, the bad, and the ugly. This is the result of the good, the bad, and the ugly. So as I said, we are in the winter of our season. And winter is the most beautiful moment because that's the time to renew. And the harsher the winter is, the better the product of the spring and summer are. So we are in the winter of medicine right now, which really a lot of great things are going to blossom. This is time where our immune system is working at the best. This is the time where our mitochondria is really rebuilding up again. It's the time where the snow, the pain, the harshness, the difficult moments, the financial crunches is what's going to make us stronger and better. And our fruits of abundance are not going to stop tomorrow. Only if we decide we are in the winter and at the end of the game. There's no end.
Thank you, dear. Thank you so much. And I'm going to thank you all for this beautiful gathering. And we're so lucky, Dalal, that you managed to be here with us and share with us. If you allow me, I would like to give the word now to the creator of this webinar from Prodigy Bureau to say the last word. And before we go, and yes, what would you say?
Thank you, Viola, for being an amazing host. We've really enjoyed your moderating the panel. Before we leave the screen, I would like to ask each one of you to leave a message for all of us. What can we do further to fight this pandemic? Because it's not yet over and we're still fighting over it. So please give us a piece of advice from your side. Can we start with Dr. Bassem?
Yeah, short.
Yeah, I mean, one point to say that, you know, I wish we had Dr. Dalal right from the beginning. Look at the energy, look at the vibe she brought to this, you know, to this webinar. I really salute her for that. All I could say is love, eat, and pray. Just take care of yourself, and hopefully we will all pass through this crisis.
Thank you, Doc.
Who would like to continue?
I can go next.
Yes, Ruchi.
I would like to say that just try to embrace the technological innovations that are out there. Like if the government sends you a contact tracing app and all, just try to help like whoever is doing on their parts for the COVID-19. So just be open to new ideas and do your best to embrace whatever new is happening. Thanks.
Thank you. Thank you. Ambri?
Yes, I would say that wherever you are in the care chain, patient, care provider, nurse, doctor, healer, best part, and in doing so, care for yourself first. I agree with that. Care for yourself to best care for others.
Thank you. Mother of three. You know a lot about this, huh? To care for your patients, for your children. Yes. Dr. Dalal?
Hope, trust, work with nature, learn from nature, work on sustainability, thrive, to touch the plants, cook, eat, natural, organic, raw. You can have it at home, vertical gardening, whether you have a small plant or a big plant, it's going to blossom, and just all the vitamins are in it. And just touch, breathe, breath, breath, breath.
Thank
And
you. Thank you, Dr.
togetherness, togetherness. We need more of this. We need to be empowering each other, and we each have our own power and our own gift.
Thank you. Thank you. Dr. Ebere?
My final note is we should have positive attitude to the problems we are facing, even if, hello, Dr. Dalla, good to have you.
Pleasure to meet you.
Yes, ma'am. So we should have a positive.
Virtual hugs and kisses.
You too, ma. Thank you. We should have a positive outlook to any problem, even if it's not coronavirus. And we should pray. I believe in prayers. And then we should have unity. I also think we should have interconnectedness so that we can help each other. What are you doing that is working? You teach other people so that we can be sources of help to each other, irrespective of the distances we have. But all in all, positive attitude, pray, and then believe in ourselves. We will overcome. It will soon be over.
Thank you. Dr. Ella?
Yes, thank you. I think never to forget our body's incredible ability to heal itself, and just to put support measures in place so that the body is able to sustain this incredible healing ability. Just let's support the foundations of health. And just to echo everything that has been said, to keep an open heart, to take deep care of ourselves, to learn to rest, to connect with nature, to breathe, to nourish ourselves with beautiful, organic, fresh, wholesome, nourishing food. It's simple. The body responds incredibly to this intelligent path of life that it is, that we are a part of.
Thank you very much. And I also want to thank Loani, Ladies of All Nations, that have created this space for this webinar and for many others webinars that we've been doing all along COVID and after COVID-19. And back to you, Love, this last word for you.
Thank you so much for all our amazing heroes. Thank you for accepting again our invitation. And our snippets of wisdom from this webinar is eat, be happy, be safe, love, and pray.
Rest.
Rest as well. Take care of yourself, because we still need you. Before taking care of your patients, you should also take care of yourselves, doctors. So thank you so much from the bottom of our heart. From Prodigy Bureau and the Ladies of All Nations International UK, Dr. Carolyn, hello, who is taking care of our backstage.
Hi, hello. It was an amazing, very inspiring. Thank you so much, everyone.
Thank you. Thank you.
Thank you so much, and God bless.
Bye-bye.
Thank you.